traumatic injuries? Right? Yeah, forward foosh, backwards foosh. Something falls on the hand, slam your finger in the door, punch in the wall, different traumatic injuries. So you're talking about what kinds of tissues get injured. Nerve tissues, bones. How do you bite bones? Yeah, as far as special test wise, you're going to have, percussion, either locally on that area or distally. Palpation, checking ligaments for laxity in the joints. All right, so then what else? So for bones, you tap on them or you press somewhere else. If you have ligament, for joints, you can compress. Where we talked about the axial compression, where you're holding a little bit more distally because you're assessing the metacarpal and the metacarpal joint and carpal metacarpal and then even maybe metacarpal phalangeal joint. So you're just pushing down like that. All right? So if we move a little bit more proximally and we're going just across this metacarpal phalangeal joint, that's the one that's the saddle joint. So there you add into that to the grinding. So you're doing some rotational stuff while you're compressing it at the same time. Okay, so those are more for joint problems, maybe some DJD, or again, it could be fracture. Okay. Now joints, anything for ligaments? What did we do for so all these different ligaments, obviously there's going to be more. You have abduction and adduction at the metacarpal phalangeals, but when you get out into here, those are more just flexion extension. So you could do valgus and varus on those different joints, like this. Okay. Anything else? No? Should cover. All right, so then now we get into contractile stuff. What type of contractile or maybe repetitive injuries do we have in the hand and wrist? Yeah. Actually, there is one other thing in the hand and wrist for a nerve tissue. We talked about this triangular fibrocartilage complex, right? That's kind of, you get more into repetitive injuries with that because you get the constantly, rotation with pressure. So you're pressing on this joint. But you can do that piano key sign where you're doing it like this or like this. That one's not really going to be on the midterm and the final, but you can know it. It's a bonus. All right. Because you'll see some of that. People will have problems in this area. You can have it's like a degenerated disc, right? You can have a DJD in your lumbar disc. You can have DJD in the wrist, in the disc in your wrist. All right. So now we get into more repetitive types of conditions. Okay. So we talked about these other ones for DJD, like the axial compression and grind, and you can even do those on the other joints. You can assess these joints in here. Right, so then what kind of repetitive, so somebody mentioned the trigger finger, right? So what are you looking for that?
It's difficult to extend the finger.
Yeah. It's usually going to be the ring finger, but it could be any of the other fingers. They're going to say that when they grip something, it gets stuck and they have to go like that. It's not really a special test for it. I mean, you could go in there and palpate. A lot of times you'll see people will have nodules or they get contractions in the flexor tendons. Okay. So if these tendons in the hand are having a problem, what do we call those? Is that intrinsic muscles of the hand or extrinsic? Is the muscle belly in the hand or is it coming from somewhere else? If it's a tendon right here, the muscle belly is going to be here, so those are extrinsic muscles. Okay, those are like flexor, carpi radialis, flexor digitorum. Actually, to go into here would have to be flexor digitorum profundus or palmaris. Okay, then what's the other contractile tissue? Anyone? What's that? What happens when you this? Well, no, it's repetitive, so it's a tendon. What the think's the name of it? Yeah, well, that's not the test, yeah. But it's de-Quervain's disease, right? So it's problem from repetitive thumb extension. Sometimes you can get it with like musicians, drums or something like that. Okay, so then basically are you doing it, is it an active resisted test or is it passive stretch, stretching at the end of the range? So you're stretching like that. Okay, so got contractile, then what's next?
Nerve.
Nerve. So what nerves do we have in the hand that we're talking about? Okay, so what's this one? And this one? This one? Right. Okay, so how does the median nerve get?
For the carpal tunnel.
Okay, so what kind of test do you do for that? So same kind of things, you either tap on it, or you narrow the opening, or you stretch it. So you got, what's this one?
The prayer test?
Reverse phalanx or prayer test. You can do it this way, you can do it this way, you can do it this way. Okay, then what's the other one? Phalanx. Okay, what else? Spinels. What else?
Compression.
Compression. Do you have to do all of those if somebody has carpal tunnel? No. You just do one of them? Sure. What you usually want to try to do for a special test is try to pick the best special test that identifies that, and then do another one to find out that it's not something else. Okay? So you might do a nerve traction or nerve compression test, and then you might do some type of contractile tissue test. So you might do, tennis elbow type of problems, because sometimes somebody can have a problem here that's going to radiate pain down into here, or golfer's elbow, they could have trigger points that are going to go tingling to the hand, or tendonitis. Because like I said before, most of the time somebody say, oh my God, my wrist hurts, I got carpal tunnel syndrome. But what is it usually? Tendonitis. So you could do some type of contractile tissue test to rule out that it's not tendonitis.